Lesson 6, we are talking about injuries, and the first word is going to be grass. Your first secret word is grass. Here we go, going right into bleeding. All right, a tourniquet is a device placed around an arm or leg to constrict blood vessels and stop blood flow to an open wound. A tourniquet may be used when severe life-threatening bleeding exists and standard first aid procedures fail or are not practical. Examples of situations where it may be necessary to use a tourniquet include severe life-threatening bleeding that cannot be controlled using direct pressure, a physical location that makes it impossible to apply direct pressure to control the bleeding, for example, if the injured person or person's limb is trapped in a confined space, multiple people with life-threatening injuries who need care, or if the scene becomes unsafe. Tourniquets may be extremely painful. If a tourniquet must be used, make sure the person understands the reason for the tourniquet and warn the person that it may be painful. A commercial tourniquet is preferred over an improvised one, but if it is necessary to use a tourniquet and a commercially manufactured tourniquet is not available, a tourniquet can be improvised using a strip of soft material that is 2 to 4 inches wide, including a triangular bandage that has been folded into a tie, and a rigid object, such as a short and sturdy stick. So bleeding, a hemostatic dressing is a dressing treated with substance that speeds clot formation. Hemostatic dressing is applied at the site of bleeding, possibly inside the wound. Hemostatic dressings are used along with direct pressure. Like tourniquets, hemostatic dressing should only be used to control severe life-threatening bleeding when standard first aid procedures either fail or are not practical. A hemostatic dressing may be used to control life-threatening bleeding on parts of the body where a tourniquet cannot be applied, such as the neck or torso. A hemostatic dressing can also be used to control life-threatening bleeding from an open wound on an arm or a leg if the tourniquet is ineffective. Common causes of nosebleeds: trauma, so getting hit in the face, exposure to dry or cold air, high blood pressure, use of certain medications such as blood thinners. If you get a nosebleed, what should you do? Make sure you have someone sit and lean slightly forward, pinching the nostrils together until that bleeding does stop. If the bleeding is severe, make sure you call 911 or the designated emergency number and continue to pinch the nostrils together. So some things about burns that could make them critical: the depth, the percentage of body surface area that is burned, the location, the age, and the cause of the burn. The first step in caring for any burn is to stop the burning. How you will do this depends on the source of the burn. To stop the burning for a thermal burn, remove the source of heat. To stop burning for a chemical burn, remove clothing contaminated by the chemical if possible. If the chemical is liquid, flush the area with cool running water for 20 minutes or until EMS personnel take over. If the chemical is a dry powder, put on gloves and brush the chemical off the skin and then flush the area with cool running water for 15 minutes or until EMS personnel take over. To stop the burning for an electrical burn, turn off the power at its source. Do not touch the person until you are sure the power has been turned off at its source. Next, cool the burn using cold or cool potable water, water that is suitable for drinking. Cool the burn as soon as possible and for at least 10 minutes. If the cool or cold potable water is not available for cooling a burn, make sure it is just not freezing, something that is not freezing, and you can use it as a compress to apply instead. Finally, cover the burn loosely with a dry, sterile dressing. If a sterile dressing is not available, a clean dressing or plastic wrap may be used to cover the burn. So, fact or fiction, burn version. Put ointment or butter on a burn to soothe the pain is fiction. Placing greasy substances such as ointment or butter is not effective. Greasy substances can seal it in and make it worse. A sunburn is a type of thermal burn. That is fiction. Sunburn is caused by overexposure to UV rays and is a type of radiation burn. When a person has experienced an electrical burn, you need to be prepared to give CPR and use an AED. That is true. The electrical current caused by the burn can also cause cardiac or respiratory emergency. Apply ice to a burn to cool it. This is false. Never use ice to cool the burn. It can cause more damage. You want to just use cool and cold water. It is important to monitor for shock when a person has been burned. That is true. Burns of all types can cause a person to go into shock. When a person has been burned by chemical in powder form, you should remove it by flushing the area with cool water. That is not true. You want to make sure to remove that powder first before running it under cool water. When a person has experienced an electrical burn, you should not go near the person until the electricity has been turned off at the source. That is true. Never go near the person until you are sure that the electricity has been turned off at the source. And the last one, to cool a thermal burn, use cool or cold potable water. That is true. A thermal burn can be cooled using these two things. And that is the end of part 1.